Hi everyone, this is Erica Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean.
Hello, Erica.
Mr. Dean, thank you for joining us today. We have some really exciting news. We have officially vaccinated over 12,000 people.
We have, and we're getting an ample supply to continue initial dose vaccinations. The viewing audience knows we had to slow that down a couple of weeks ago because the state of Georgia's supply slowed down, so we slowed down. But I'm very pleased to tell you that we've called everybody we can that we had to delay initial dose, got them back in, and now we're in an expansion mode. And then most everyone knows, if you haven't heard, yesterday the governor announced an expansion of more eligible recipients. So we're really excited about that. Our teachers in the area and others now will be eligible, and he went on to say that if the supply continued, we'll be able to open it up to age 16 to 64, certain types of patients in that age group by the end of March. But now that's to be determined. Right now we're just excited about our teachers and others. 12,000 vaccinations. The line is moving smoothly. Those of you that have been through it, you probably recognize that our staff is doing an outstanding job. Kind words, warm smiles, and gentle touches with those vaccinations, as much as that can be when you're having a vaccination. But they're doing a great job. We're geared to do more. Erica, we've restarted vaccinations on certain days up at the Berrien and Lanier campuses. So those campuses and counties are now accessing vaccinations. So we're just really excited to be at this point in our journey with COVID. You know, we started, the filming here without our mask. I just want to remind everybody, masks are still important until we get through this thing, but I guess being outside, we are a little more relaxed, and you and I have been vaccinated.
That's right. And Mr. Dean, what are we seeing in the hospital? Numbers still declining and staying steady?
We're down to 28, I believe, COVID inpatients today. Now the hospital is very busy with other types of patients. Y'all remember we did not interrupt services during this last wave. We had up to 90 inpatients at one time, 28 still too many. But less on a ventilator and again, less patients being treated as inpatients. Those that are coming through the ER are still receiving the monoclonal antibody therapy through our infusion center, which continues to operate. And we'll continue to operate the testing line at Smith Northview. But I would tell the viewing audience, look out for a bulletin. We'll probably pull that back. We're down to testing only about 100 per day, so we may run only a half a day versus a full day on some days, but we'll get that notice out to you. Overall, everything's trending in the right direction. Less positives, less number of diagnoses, less hospitalizations, and more vaccinations. That's a great equation to get this thing behind us, Erica, and I think we're well on our way. This is the day we've been looking for. If you remember, March 11th was the day we had our first COVID diagnosis in our health system, and it changed everything forever. Our team's done a great job. Very proud of our entire staff throughout our 4 campuses. Really proud of our critical care nurses. Really proud of our COVID unit nurses, all those professionals and everybody that's working up there. But we've been looking forward to this day. Now, we're not out of the woods, but we do believe we're well on our way with the number of vaccinations that we're delivering in the community, in the region, and across the state of Georgia.
Yes, it is certainly very refreshing. Outside of COVID, we've had a lot going on for our labor and delivery and women's services in the hospital. Do you want to tell us a little bit about that?
I do. It's always fun talking about, the birthplace and babies being born. It's a happy time. People come to the hospital when they're sick, but they come here also to give birth, to create life. If you think about it, it's a beautiful thing. The birthplace is undergoing a lot of change right now. Number one, the OB Hospitalist program that provides 24/7 OB coverage to anybody, whether you've seen an obstetrician locally or you're just traveling through. These obstetricians that are here 24/7 are available for you. So if you need them, you can come in through our emergency room, and of course they're available if you need them. If you have an OB emergency, we have created an OB emergency department. And that OB emergency department is a program where you are evaluated by a physician. Again, one of these physicians that are here 24/7 are available to do the evaluation, to do the check, if you will. If you need to be checked, something's going wrong, you're a little uncertain, they're here. They are not here to substitute for your private obstetrician. They're here to support them, and they work in tandem with them. So they're not here for to take those patients or to treat those patients in the absence of the private OB, but they do support them, and sometimes they will help make sure you're taken care of in a timely manner. Our goal is to be the safest, most convenient, and obviously the most service-friendly obstetric service in the region, and this is one step forward. Couple that with Angel Eye, the technology that's allowing families from really across the world to look in and peer in and check on mama and baby. That's live, and that's been well received. We've had a lot of great comments on that. We have a women's health coordinator that's helping navigate. That program is getting off the ground, and that's a specialized nurse that'll help us help women in the birthing experience get through the process a little more easily. The wireless fetal monitors, we talked about that, outstanding technology. Just women get to roam around now instead of being wired, if you will, to a bed where they cannot roam. And then, of course, bassinets, new equipment, and we're planning for some more facilities, and we'll talk about that at a future date. We're growing the number of obstetricians in town. We have added one more, and we aim to have more that are coming. We just think we have to be about the women in our community and their health, and I just want the viewing audience to know we're committed to that, and a lot of resources being poured into it, because the women are the center of our health and our family. I know at my house, my wife, she directs traffic, and but they're the last one to get care sometimes because they're so busy. And we need the women in the community to have a place they can go where they can get comprehensive women's health care. And we really appreciate the support we're getting on this, and all the technologies here just to make that even better.
Very wonderful news. We have so much going on for the birthplace and just women's services in general, and you can find all of that information on our website because it is a lot. So definitely stay tuned into that. Is there anything else you wanted to share with us today?
Yeah, just the community is seeing investment in various services. I don't talk about everything because there's not enough time to tell you, but I will tell you your team of health professionals here at South Georgia Medical Center are on the move. We aim to be your destination for care when you can't receive it elsewhere. We're partnering with your physicians. The team is growing, our services are expanding, and what we want to be is what you need us to be. We want to earn your trust one touch point at a time. New surgeons that are here, those that are coming, plenty more. You'll see lots of announcements. Keep your eye on our social media posts and other posts, and you'll hear more about that. New facilities are being developed. The graduate medical education program, Erica, we need to speak about that a minute.
Absolutely.
This is exciting, y'all. We have just become accredited by SGMC, the accrediting body for academic medicine, for teaching hospitals, if you will. We're now a teaching hospital in the state of Georgia. And what that means is that physicians, doctors who finish medical school will apply to come to a specialty training program here called a residency training program, and they'll be trained in a certain specialty. The specialty that we have been accredited for is internal medicine. And in that, in 2022, we will host our first class of 8 physicians that'll come, and they'll be with us for 3 years in this community. They'll live here, they'll work here, they'll see patients here, and then by the end of the 3rd year, there'll be 24 of them. Again, 1st year, 2nd year, 3rd year. And then within that time frame, another residency training program will have started, and it's called emergency medicine. And we'll have 6 in the first class, and they'll be here for 3 years. So there's a point in time in our future where we'll have 42 physicians training here to be specialists. It is an outstanding program. It is about teaching, it is about academics, and our relationship with Mercer University and all of that is coming to fruition. It's really going to help us be even better at the bedside and help us train a pipeline of physicians for the future. Those of us that are aging out need others to come in and help us. And that's what the goal is with the residency training program.
That's very exciting. I can't wait to see the halls filled with all of these medical students. It's certainly a great thing for our community and for our hospital.
It is.
So that's good. Is there anything else you want to
Well,
share?
just thanks everybody for the support. We feel it, your kind words, online reviews, your comments, your feedback, your direction. We just thank you. Our nurses, our staff, all of our employees, support professionals, food, environmental services, maintenance, all of the respiratory therapy. Everybody's done a fabulous job, but I'll just tell you, they give it back to the community. They know that you're there cheering them on, and they work harder when they know that. And thank you for letting it be known.
Thank you. Thank you everyone for tuning in today. Please, like we said, follow our social media, follow our website, because we have a lot going on and we want to keep you informed so that you can make the best choices when it comes to your health care. So thank you, and y'all have a wonderful day.
Thank you.